Today I'll be talking to you guys about cancer therapy, traditional chemotherapy versus nanoparticles. So just as an overview, I'm going to be answering the question, can nanotechnology be used to deliver drugs more effectively in the human body? So I'm going to be talking about what chemotherapy is, what the cost of chemotherapy is, how effective it is, and on the flip side, do the same with nanotechnology, and then give my verdict of which is better. So what is chemotherapy and how does it work? So typically cells have a pretty predictable cycle that they go through with their splitting process. The dark blob that you see here in the middle, that's the nucleus. In a cancerous cell, the gene that tells the cell to stop splitting is damaged or it's turned off. So they keep splitting and splitting and it can turn into a tumor. What chemotherapy does is the drugs, you can be taken either through a vein or you can take it with tablets as well. It goes in and it attacks the nucleus where the genetic material is in the cell cells that are rapidly splitting. It causes the cell to stop dividing and it causes a spontaneous death of the cell. But on the bad side of that is that it'll attack other healthy normal cells that split continuously as well, like in your digestive system, in your bones, your hair, which is why a lot of people that go through chemotherapy, they have hair loss, they get nauseated, or their bones become really brittle. The cost of chemotherapy, so the average cost right now is somewhere between $20,000 and $26,000. The initial treatment on average is about $7,000. It's increased from $4,000 to 1991. So see here on this graph, this is how much we've been spending on cancer throughout the years. So you see here in 1963, we started at $1.3 billion. And in 2010, we increased 100-fold. And the reason that cancer treatment is becoming so much more expensive is because people are living longer. And the longer you live, the higher probability you'll have of developing cancer. And chemotherapy, how effective it is, this is an example of lung cancer. It mostly depends on how long you've had cancer. So here it is in months. Once you reach about 2 years, you hit about less than 10% rate of surviving. Supportive care is just, it's what you get to alleviate the side effects of cancer. So like if you're aching, then you can get like a massage, and that's just what supportive care is. Okay, so there's a lot of different nanoparticle-based cancer therapy treatments, but I'll mostly be talking about magnetic nanoparticle-based cancer therapy, and it can do all these things that you see around the circle, but I'll be targeting drug delivery and magnetic-specific targeting. So nanotechnology and how it works. So in the center, you see here these drugs, they're protein toxins. They're being transmitted via receptor-mediated endocytosis, and endocytosis is when things are taken into the cell. See here on the left side, these are target-specific, and in this case it's tumor-specific ligands that are attached to immunomodulators, or cytokines as we commonly call them. And they're dispersed on the cell wall densely to elicit an immune response. And a good way to kind of think about this, because it's a little complicated, is kind of like a Trojan horse aspect. So cancer cells, tumorous cells, they have what are called receptors. So a lot of them have protein receptors with antibodies or folic acid. These ligands will take in like folic acid or an antibody to the cell to elicit an immune response, where the enzymes will turn the prodrugs into active drugs and then kill the cell, if that makes sense. So this is just a picture of it in action. So here's the tumor, and then these are the nanoparticles that are localized then within the tumor. So the cost of nanomedicine, as of right now, is really, really high because it's such a new technology. So it's making mass manufacturing difficult, and it's creating a monopoly for those that have the patents for nanotechnology. It creates an economical disadvantage in the fact that people that have more money, they'll be able to spend it on this newer technology versus traditional chemotherapy. But it will gradually decrease, as with any other medicine, as generic products hit the market and as the patent expires, which for medicine is about 20 years. So we'll see it going down in about probably 20 to 50 years. It'll be more available to the public. So just showing that there is an emergence of nanotechnology and it's becoming more common. So we see that the number of publications have gone up. You can see the leading countries here in the bottom. And then you can also see the number of publications and patents that have gone up over the years here too. So we've hit over 500 patents in 2013, where we started with barely any in 2001. So how effective nanomedicine is, there haven't been so many human trials that you can collect a lot of data, but there have been experiments on animals, so that's where I collected this data from. So here they injected the magnetic cells right here into the carotid artery of a rat. And you can see right there that it's been magnetized. Here they injected to cancerous cells. So here is week 0, and then you can see that this is when it's been activated. So you can see that it's like getting to work. And then after 4 weeks, the main point you see here is that it's almost exactly like how it was at the beginning. And then this is another example of a tumor that shrunk with the use of nanoparticles. And talking about nanomedicine and its future, we're looking mostly at nanomedicine, not the regenerative medicine. RMNI is the source that I got this from, and they're regenerative medicine and nanomedicine institution. So most researchers feel that there's going to be a great influence, or a heavy influence in nanomedicine here. You see it, most people think that there's going to be a huge influence on health treatments in the future. So in the end, looking at chemotherapy versus nanomedicine, this is like a surgery if you're removing a tumor. This is radiotherapy. Chemotherapy will mostly go into systemic drugs here. And iron focus is just the name of a certain type of iron oxide particle. So you see here that there's no side effects. You get cellular resolution because it's magnetic. You can see it in an MRI scan, which makes it easier to detect cancer. You can deliver them anywhere, and you can dose multiple sites at a time. Have no radiation. With chemotherapy, you only get 2 of those benefits. So chemotherapy is good in early stages, as we saw. In this graph. So in the early stages, chemotherapy would be helpful because you have a higher percentage rate survival. But it becomes harder the longer that you've had cancer, and it gets more expensive, and the cost of it becomes high too, and it's very uncomfortable for people that lose their hair or get nauseated. Whereas with nanomedicine right now, it's extremely effective, as shown in our tests with animals right now, but it's very expensive. So I wouldn't expect like nanotechnology to be economically logical now, but as it lowers in price, I think it'd be a better alternative to traditional chemotherapy. Questions? Yeah?
Are there any human trials being done right now with the nanoparticles, or have there been, or is it still pretty early?
There's been like 1 so far, and it was a success, but there aren't very many right now. Any other questions? Yeah?
It sounds like that the traditional chemotherapy is good if you get it right up front, at the early stage. Are they, I mean, it's too soon to tell, but is the nanoparticle chemotherapy, is that actually going to be helpful even if it's a later stage? Is that what they're thinking?
It's going to be easier to detect cancer earlier on. So because of the receptor-mediated endocytosis, they can attach to the cancerous cells quicker, and then it'll show up in an MRI scan, whereas as of right now, you kind of have to feel it coming or be testing for cancer through blood. So it'd be easier to catch it earlier on.
Oh, so it's also easier to catch it earlier on, plus...
And then it's more effective, and you won't kill your healthier cells.
Okay.
Any other questions? Yeah?
Are there, you mentioned the cost, are those more capital costs, or is it more, I don't know what the other word is, recurring costs for, like, is it, you have to pay for a big plant or some sort of big heavy machine to be able to do all of this, or is it just more of a,
it goes in that, and it's such an
type?
intricate process right now that it's hard to mass manufacture without spending a ton of money.
Okay.
Yeah?
How do they identify the cancer-specific antibodies?
How do they identify it? Just from what we know from before, when you take blood and then we see the receptors that cancer cells have. So they'll have certain types of antibodies on the cells that are different to healthy cells, or like the folic acid receptors will also be different compared to healthy cells. Yeah?
Sorry, Jake, ruined my thought.
Okay.
I do that all the time.
Actually,
Yeah?
You didn't mention any side effects.
There are no side effects, and the body's immune system can actually clean it up once it's dead, or if it's a tumor, you can just have it surgically removed after it's died.
Wow.
Yeah.